Recognizing students who are depressed and/or suicidal does not initially seem to be something that many of us will encounter. However, with the rise in student mental health issues, including suicidal behavior, we must recognize that educators can have a role in preventing student tragedies such as suicide. Many educators feel they lack the knowledge and expertise for dealing with students' mental health needs, and some may feel that it is not their responsibility to address these issues in the school. While we don't expect you to provide any type of treatment to affected students, we do expect you to have the knowledge and competence to identify students affected by mental health problems and refer them to appropriate mental health services in the school or community. As we discussed in Module 1, students might display a wide range of behaviors and characteristics that would tell us something may be going poorly in their lives. Sometimes we won't know specifically what is going on, but we will know that there is something wrong. Honing in on changes in students' behavior and considering that behavioral or mental health issues may exist is important to assist students. The objectives of this lesson are to familiarize yourself with the warning signs, risk factors, and protective factors that are related to student depression and suicide, and to have the knowledge and skills that will enable you to identify and make an appropriate referral should the need arise. First, let's start with a quiz. True or false? Most people who attempt suicide are just looking for attention. The answer is false. Children and adolescents who view suicide as a way to manage their intense emotions are often just looking for a way to make the pain stop rather than for attention from others. True or false? Girls attempt suicide more often than boys. The answer is true. Girls experience depression at higher rates than boys, are 2 to 5 times more likely to have suicidal ideation, a plan for take their lives by suicide, and will attempt suicide more often than their male counterparts. True or false? Children can't really be depressed. They don't have anything to worry about. Unfortunately, the answer is false. Many people incorrectly label depression as a feeling based on life events or stressors. Depression is a chemical imbalance that can impact both children and adults. It is estimated that 3% of children and 15% of adolescents have clinical depression. Fill in the blank. Suicide is the blank leading cause of death among 15 to 24-year-olds. The answer is second. Suicide is the second leading cause of death among 15 to 24-year-olds in Ohio. The number of youths committing suicide has risen 18% since 2001. True or false? Alcohol and drug use are related to depression and suicide. The answer is true. Students who use and abuse substances are often trying to escape other pain. Using substances can be a temporary relief from their pain and can serve as a maladaptive coping strategy. Additionally, it can lower inhibitions, and life-ending decisions can be made while using substances. Unfortunately, the numbing effects of substances don't last, and the student is left feeling even more hopeless and helpless after using. True or false? Asking a student if he or she is suicidal will just put thoughts into the student's head. The answer is false. If you believe a student may be suicidal, you should not be afraid to engage the student in a conversation about what he or she is feeling or thinking. If a student is thinking about suicide, it is important for adults in the student's life to know this information so they can help. It may help the student feel that someone is connecting and caring about him or her. You are very unlikely to put suicidal thoughts or ideas into the student's mind. Now that we have discussed some of the common myths and facts about depression and suicide, it is important that we know how to actually identify students who may be experiencing depression. Generally, students who become depressed will evidence changes in their behavior, their appearance, and their performance. It is important to note that the characteristics, traits, and behaviors that we discuss may clue us in to the fact that something is going on in the student's life. It should be noted that not all students who are depressed will show these behaviors, and not all students who display such characteristics are necessarily depressed. This module should provide you with some additional information to assist you in understanding potential behavioral and mental health issues in a student's life. Changes in student behavior may include things such as mood changes. Students may indicate their depression through irritability or anger rather than sadness. A lack of interest or pleasure in activities that were previously enjoyed and withdrawal from family and friends should also be noted. Finally, the use and abuse of substances is related to student depression. You may also notice changes in the student's appearance. For example, noticeable changes in weight gain or weight loss. Changes in sleep should also be noted, specifically sleeping much more or much less than usual. Educators should also notice students who seem to suddenly lack personal hygiene and self-care. Changes in school performance may also be an indicator that something is going on in the student's life. Sudden drops in grades, lack of interest in school and school activities, skipping school, and acting out while at school should be noted. Students may show frustration with school and school personnel and have difficulty concentrating on tasks. Many students who are depressed will also have thoughts about suicide. In fact, about 50% of students with depression have suicidal ideation at some point. According to the 2011 Youth Risk Behavior Survey, 27% of Ohio teens reported feeling depressed, 14% reported having seriously considered suicide, and 9% reported attempting suicide during the past year. In addition to the signs of depression, you might also notice additional indicators of student suicidal behavior. It is imperative to identify students who may be thinking, writing, or talking openly about suicide. Students who may be giving away their possessions, or students making comments such as, "You won't have to worry about me when I'm gone." It is important to note that students may come to suicidal behavior differently than adults. Intense emotional events such as breakups or being ostracized by friends can be the catalyst for suicidal behavior. Research indicates that some factors are associated with an increased likelihood of student suicide or suicide attempts. Of specific importance is the increased likelihood of self-identified gay, lesbian, bisexual, and transgendered youth to complete suicide. These students often lack an effective support system and can feel very isolated and alone. Research also tells us that there are factors that are related to a decreased likelihood of student suicide. While it is important to identify a student who is depressed and/or suicidal, it is equally important that you know what to do in such a situation. There are ways to better understand what a student may be going through by simply talking to the student and showing that you care. Asking specific questions may assist you in recognizing that a student may be dealing with depressive or suicidal thoughts. Here are examples of behaviors that are appropriate reasons for concern. Younger students may make negative statements about oneself, such as "I hate myself" or "I am stupid." They may create dark artwork or poetry and show signs of low self-esteem. Older students may show persistent sadness and hopelessness, withdrawal from friends, family members, and activities they once enjoyed. Indecision, lack of concentration, or forgetfulness. A mental health professional generally determines the level of risk of a student's suicidal behavior once the student is referred. However, some understanding of suicidal risk may help you in recognizing these warning signs and in communicating with parents, school counselors, or community mental health professionals about them. Your awareness of these signs can help you know what to do immediately in seeking help. There are 3 things that you want to keep in mind when inquiring about suicidal ideation. SAL. This stands for a specific plan, the availability of means, such as a weapon or drug, and the lethality of the means. Keep these things in mind as you talk to a student who may be suicidal. First, ensure that you remain calm when talking with the student, even though you may feel very nervous and anxious. The student will mirror your anxiety, so a calm presentation is important. Next, you may be one of the few people in the child's life who is showing care and concern for him or her. Emphasize the student's worth and let him or her know you are concerned about his or her well-being. Be sure not to promise secrecy or confidentiality and to let students know that steps will be taken to maintain their safety. It is imperative that you know the school's protocol on how to handle students who are suicidal. The protocol should include instructions on where specifically you should refer students who need intervention, who is to contact parents, what to do in an emergency. Once these behaviors have been identified and the student has been referred to the principal or their designee, resources for helping students and their families are available at the local, state, and national level. Locally, community coalitions provide the opportunity and structure for allied groups to pursue coordinated strategies to educate and increase public awareness that suicide is a public health problem. Coalitions are committed to reducing stigma, which helps increase people's ability to seek help and ultimately prevent the loss of life. In our state, the Ohio Suicide Prevention Foundation advances evidence-based awareness, intervention, and methodology strategies which will support all Ohio-based suicide prevention efforts. National resources include the Substance Abuse and Mental Health Services Administration. This organization provides information and resources to seek help, provide assistance, and/or implement suicide prevention programs in their communities. In conclusion, know that you have the capacity to substantially impact the life of a student if you can identify and refer students who may be suicidal. Some key points to remember as we conclude are: it is important to note that the characteristics, traits, and behaviors that we discuss may clue us into the fact that something is going on in the student's life. It should be noted that not all students who are depressed and show these behaviors and not all students who display such characteristics are necessarily depressed. While it is important to identify a student who is depressed and/or suicidal, it is equally important that you know what to do in such a situation. Keep these things in mind as you talk to a student who may be suicidal. It is imperative that you know the school's protocol on how to handle students who are suicidal. The protocol should include instructions on where specifically you should refer students who need intervention, who is to contact parents, and what to do in an emergency. This concludes lesson number 2. You can find additional resources on the following slides.